Thanks for watching this interview with Dustin Rudolph, the plant-based pharmacist. You can check out his website and his Facebook page and his book in the description below. I'll leave links. In 5 years of being on this lifestyle, not a lot surprises me, but reading this book, it was a wealth of knowledge, and I read a lot of stuff that I didn't know before, so I highly recommend this book. I understand a lot of people don't want to watch a 1-hour interview, so what I've done is I've segmented this 1-hour interview into questions and topics. You can go down in the description and click on the hyperlinked time that will fast forward you to that particular topic or that particular question. So if you're not interested in these subjects, but you really want to hear what Dustin has to say about this subject, you can skip forward to that. I understand. An hour or an hour and 20-minute interview is a long time. So I hope you enjoy this interview, and comment and ask questions down below. Thank you very much. Hello again, Dustin Rudolph. I was curious. I added a couple questions from when we had an interview last time. I really wanted to know where your roots come from, why you wanted to become a pharmacist in the first place.
Well, I wanted to become a pharmacist way back in fourth grade, so it was a long, long time ago. And when people ask little kids what they want to do when they grow up, usually they say something like they want to be a baseball player, they want to, be a ballerina or something like that. And I said, I want to be like Todd. And Todd was our hometown pharmacist. I'm from Baker, Montana, which is a small town, southeast Montana. We had one doctor and we had two pharmacists in the whole town. So Todd was our family pharmacist, and from the fourth grade on, I always said when I grow up I want to be like Todd. So that's kind of where it all started.
Okay, did you ever shadow him or a pharmacist, or just pretty much you knew right off the bat that's what you wanted to do?
I guess I just chose that as what I wanted to do in the fourth grade. I'm
sorry, go ahead.
As the years went by, like as I got into middle school, high school, and then on into college, the science was a big draw for me. It's a big interest of mine, and math too. But I really like science, so it just kind of fit.
So he must have been quite a role model.
Yeah, I love Todd. Yeah. He was very, very nice, very helpful.
And along the same lines, when did you get your start into this plant-based nutrition and using plants as medicine, and why?
So that wasn't until like 8 years into my career. I had no idea about any of this information on plant-based nutrition and health and chronic diseases, because when we go through school, we just learn the medicines and we learn the diseases, but we don't really learn what the root cause of these diseases are. So I had some nutrition training in school, but it was all on parenteral nutrition, which is nutrition through the IV line, basically. When somebody goes into surgery and then they can't eat afterwards, or if their bowel's not functioning. So we learned about that kind of nutrition, but that's not really good nutrition.
Right.
So we didn't learn about actual food. Now, I didn't learn about this until 8 years into my career. When I went to my podiatrist office, I was having some nerve pain in my left foot, and I went to see my podiatrist, and it was during the healthcare debate before the law was passed into effect. And I was reading a Time magazine article on pros and cons of kind of both sides, and I took it into the exam room with me, and Dr. Sal came in, and Dr. Sal said, "What are you reading, Dustin?" And I go, "Oh, there's just this Time magazine article on the healthcare debate. It's really interesting. It's got good sides or good points on both sides." And we got to talking about this and the healthcare crisis and all this stuff. And Dr. Sal said, "Well, Dustin, it doesn't matter what they legislate. It's not going to fix the healthcare crisis." And I'm like, what is this guy talking about? This is the whole point of the passing a healthcare bill.
Right.
And I go, I don't understand what you're talking about. What do you mean? And he goes, well, you can't fix the healthcare crisis unless you have a nation full of healthy people. And he goes, you have to do that through diet and lifestyle. You can't do that with a piece of legislation. And the light bulb just went off right there for me. So at that point in time, he was the first one that kind of introduced that approach or that view towards health. And then he gave me his reading list that had 4 books on it. And I asked him, which one of these 4 should I read? Because I'm not a very fast reader. I like to take everything in and be very thorough. And he's like, definitely the China study. Read that book. That was on there. And Dr. Russellson's book was on there, the Prevent and Reverse Heart Disease.
Yeah.
And a couple others. But he said, read the China study for sure.
Neat.
So I read the China study, and then, the rest is history.
Cool. Very good. That's a cool, neat roots. I'm curious, can you describe your current job and what you do on a daily basis? What does your day look like?
So I'm actually a clinical hospital pharmacist. And I used to work in retail when I got out of school, but I switched to hospital pharmacy. It's a whole different world than what a lot of people would think that a regular pharmacist would do. They're behind the counter, they're counting pills, they're counseling patients. I don't do that in the hospital. You take care of inpatients. So you're kind of behind the scenes. You're working together with the doctors, you're working together with the nurses and the other staff at the hospital. I don't get a lot of time with patients at all, really. So it's more behind the scenes, it's more clinical work. So, when people come in and maybe they have an infection or a pneumonia or cellulitis or something like that, and the physicians, they'll say, pharmacy, we want you to dose the antibiotics. And so that'll be our job. We'll have to go through the chart and the notes and see what's wrong with the patient and see what their labs are, see how their kidneys are working, their livers are working, all that good stuff. And then, dose them appropriately and monitor them and follow them and go forth with that. And then there's other medications that we have to dose that are, based off kidney function and maybe the height, weight, maybe the age of the person, all that kind of good stuff. So that's kind of what we're doing in a hospital. We're also getting the medications ready. We have pharmacy technicians who do a lot of the great work that get the medications prepared for us pharmacists to check it before it goes up to the patient floor to be delivered and administered to the patient. But a lot of what our work is as a hospital pharmacist is on the clinical side.
So it sounds like you're taking quite a bit, obviously not all, but you're taking quite a bit of the responsibility of and the liability off of the doctors in a way, and some of that's landing on you guys because this is what your job is to make sure there aren't any adverse reactions to other medications, make sure the dose is right for the patient. So some of the responsibility ultimately rests on your shoulders, and that seems like quite a bit of responsibility.
Yeah, it is. And today in healthcare, everything has become so specialized that there's physicians for cardiology and nephrology and oncology and they know their area very, very well. But when a patient's in the hospital, you have maybe 3, 4, 5, 6 different doctors seeing that one patient, and they're not coming at the same time every day and talking to each other. And so maybe one physician orders these 2 or 3 meds, and another physician orders this 1 or 2 meds, and they don't, they've got so much going on that they don't have time to gather together all in one spot and talk about the care plan together, physically together, face to face, and then decide what they're going to do. They're in and out, and then they got their office that they're trying to see patients in, and they got all these responsibilities. So some things would fall through the cracks if we weren't there or nursing wasn't there to be watching the patient, and we're specifically in charge of the medication to make sure that nothing goes wrong with the medications and that it's right for that patient, the right disease state, the right dose. There's no interactions, there's no allergies. So it is a lot of responsibility, and I always try to think that now, knowing the nutrition and health side and knowing the medication and the conventional side of medicine, I like to think that probably one of my most important responsibilities as a pharmacist, being a real pharmacist, is preventing harming the patient further.
Right.
I can only do so much with the pills to kind of get them by. But a lot of these chronic diseases don't need pills. They need changes in nutrition and lifestyle. And, that's a whole different arena.
Right. So I think you said before in our previous interview that you don't necessarily consult with the doctors when it comes to plant-based nutrition and plant-based interventions. However, you certainly could say to the doctor, hey, doc, this patient's taking this medication, you just prescribed this medication, and that's not going to work because it's going to react adversely. Like, you have those dialogues with the doctors. You work hand in hand.
Oh, yeah. All the time.
Yeah.
I do that kind of stuff all the time.
Yeah. It sounds like a lot of responsibility that scares me, so good for you. So in your book, which I'll get your book out in a minute from the bookshelf, but in your book you say that, and in 4+ years of being on this lifestyle, I've experienced this, is that for every studies come out and they kind of go viral on all these Facebook groups that I'm part of, where it says, for every study that says, a study says that bacon is good for you, and then studies come out that say bacon is bad for you. How is one supposed to decipher and filter through this, conflicting information? I mean, for that, there's no gray area. I mean, it's like, this is bad, this study said this is bad, this study said this is good. What can people do to filter through this information that is so starkly in contrast to one another?
I think that's a great question, Ian, because a lot of people out there that are consumers of health, and they don't necessarily have the background in medicine or science. And it is very confusing when you look at the news and they're saying one thing one night, and then the next night they're saying something completely the opposite. And you're like, I don't know who to believe.
Right.
So I think I'm just going to eat whatever I want.
Right.
And even for those of us in the medical field and scientific community, it still takes years of practice to get it right. And I'm still learning, and I'll be learning 30 years from now. Mm-hmm. But what I look for when I look at studies is that, first of all, who's funding the study? So you know that if it's a drug company funding their own drug study, then it's been shown that there's more favorable results for that drug on those studies as opposed to independent studies done. Mm-hmm. So if you have the Beef Cattlemen's Association sponsoring a study on beef and health, obviously they're going to want to have something positive to say about their product because they don't want to hurt sales. Mm-hmm. So that's one thing that you got to look at.
So
and that
in other words, that's called a conflict of interest, just to kind of get that out there, right?
Conflict of interest. Right. And it doesn't mean that any study that has a potential conflict of interest is completely worthless.
Right.
And you just throw it out. Mm-hmm. It doesn't mean that at all. You can still get some valuable lessons, but you have to take it with a grain of salt. You have to take it with knowing that there's potential for bias here, and there might be some erroneous results mm-hmm. that are reported, especially if you don't look at all the details. Mm-hmm. So that's one thing. And then the other thing is I really have tried to do my best to find the organizations and the people and the researchers out there who don't have ties to industry and regularly publish stuff as unbiased as it can get. Mm-hmm. And a couple of really good ones is thennt.com, and that's THEN as in Nancy, as in N as in Nancy, T, thennt.com. They go over all kinds of different medications and other conventional therapies and different medical conditions, and they really give you the unbiased version of, is this good for you or is this bad for you mm-hmm. with this drug? Mm-hmm. Another one is the Cochrane collaboration. They're a not-for-profit organization. They strictly prohibit funding from the medical device and pharmaceutical companies, and they will do unbiased research and put reviews out there, Cochrane reviews out there. So that's nice to see too. And then there's really good physicians and other researchers out there putting forth unbiased information, like Michael Greger with nutritionfacts.org and John McDougall, Caldwell Esselstyn, all those guys, I've really found that they're very, very good at, looking at the information and fairly evaluating it.
Mm-hmm. Mm-hmm. Mm-hmm.
So it's just a couple tidbits there that I kind of look for, and it's a matter of continuing to look at the research, and then you also got to look at in the studies are they say if you test for cholesterol levels and the consumption of milkshakes, is that going to raise your cholesterol level? And so you get done with the study and it says, well, it raises your cholesterol level a little bit, but that shouldn't cause any harm. But it didn't test for death rates, or heart disease rates or something.
Mm-hmm.
Well, now you're just having a study that looks at numbers, and nobody really cares about their cholesterol level if it weren't for the cholesterol level being high kills you.
Mm-hmm.
You know what I mean? So what really people care about is whether they're going to die or not, or whether they're going to be crippled from a disease or not.
Mm-hmm.
So, I could care less what my cholesterol level is, but I care if I die of heart disease.
Right.
And they are correlated. So, you got to look at studies. What are they testing?
Right.
What are the end results?
Something I like to encourage people to understand about research, and I'd like you to briefly touch on this, is something called the body of evidence. Over the last, we'll say 20 or 30 years, more and more research has been coming out pointing towards food as medicine, pointing towards cholesterol as being a marker of either someone who is healthy or someone who is not. And so if by chance one study comes out that happens to say, oh, cholesterol isn't really a marker, it really isn't that important, it may move this body of evidence a tick back towards the side where it says cholesterol is not good, but it doesn't necessarily take this body of evidence, which is hundreds of studies, and throw them all in the garbage. Is that correct?
Right. Exactly. That's a great point. Yeah, you got a great point there, where you can't just take any one study and go, well, that's the Bible.
Right.
So that study says that's the Bible for everything. You got to look at the magnitude of all the evidence, like you said. You want to look at observational studies, epidemiological studies, population-based studies. You want to look at interventional studies where they actually take people and split them up into two groups and, do whatever intervention they're doing, and then follow them and see exactly what happens to them, on a pill or on a certain diet or whatever they're testing. And then you take all that information combined and you look at trends. You look at, is cholesterol important, and does it lead to heart attacks, and does it cause death, or is this overblown, and what does all the science say about that?
Mm-hmm.
And that can be a massive undertaking, especially for people who don't do this for a living and aren't in this field, because every day I'm reading stuff,
right,
studies or reports or whatever it is, and I've been doing this for years. And for somebody who's just off the street and not in this field to maybe look at one study every 10 years, it's almost impossible to get a good feel for all the scientific literature.
Right. And just to add to that is someone who people think they read one study and think they're an expert on subject XYZ, and that's not necessarily how it works. It certainly isn't how it works, because if someone reads a study on pharmaceuticals, it doesn't mean you went to school to be a pharmacist. It doesn't mean that they're smarter than you or they're now an expert. And so also the point you just made is even more of a reason to look at the resources like the NNT.com, the Cochrane Collaborative, sources like Dr. Greger and Nutrition Facts, because that's what those organizations are for. They're for average people let's say average people who don't read literature, who don't have the time, you can just go to nutritionfacts.org and get a summary of what the literature says.
Exactly.
Yeah.
Exactly.
For people who may be into conspiracy theories or who may be more pessimistic in their view of medicine, may think that doctors in some way are incentivized to prescribe certain medications. Does this have any validity in your experience?
Well, first of all, it's illegal for a doctor or a pharmacy or any healthcare professional to be directly paid to use a specific product for their patients. So that's illegal. You can't do that. It's not illegal to do things like a drug company has a dinner, and they pay for the dinner for the healthcare professionals coming, pharmacists, doctors, whatever, who's ever coming. It's usually at a fancy restaurant, filet mignon, all that fancy stuff. And then they have a doctor that they paid to come in and speak on behalf of their company for a drug that they have coming out, and to talk about the benefits of that drug and how it works, and how what the studies have shown. At least usually it's from the pharmaceutical studies that are out there. So that's not illegal. And when you go to those things, I used to actually go to those things early on in my career. When you get out of college and somebody says free food, you go.
Sure.
Because who doesn't?
Yeah.
But now that I've gotten into my career and I've done all this research and I've kind of learned how the whole industry works, I won't participate in those at all.
Now,
because
go ahead.
Because I mean, I literally was like going to those, and then I'm looking over to the side here, and my grandma can't afford her medication.
Right.
Because it's too high, and she has to get something that is older or whatever, because she can't afford it.
Right.
So I just personally and professionally, I was like, I can't do this anymore.
Right.
And but a lot of people do go to those things.
Now, now let's say I'm a wizard and I have a magic wand, and I say, Dustin Rudolph, I'm giving you unlimited power. Would you like to see less of this? Would you like to see less of these pharmaceutical-sponsored luncheons and have a rep up there talking about their medications? And sort of, are these paid luncheons and dinners or whatever harmful or helpful, or neither, in your opinion?
I think they err on the side of being the harmful scale. Not that they're completely not helpful, because you do learn of new products and stuff coming out, but you're getting a viewpoint that's kind of specifically biased towards that one side.
Sure.
And so when you go back to your practice, you psychologically, there's no human being that can just block all that out and say, okay, I'm not going to be biased because I know that I went to this dinner and I heard about this great drug, and it really is the best thing since sliced bread, and I know that because I've done all my own research too. I mean, you can't. I don't think anybody can psychologically just shut that off and like completely separate it and then do their own research and not have that affect how they think.
Right.
And that's why the pharmaceutical companies do that.
Right.
Because they know that it does influence physicians and pharmacists and whatnot. So I think that it. I really don't think that drugs should be marketed at all, especially direct-to-consumer advertising on TV. I think that's one of the worst things that can happen.
Right.
Now you have patients going into the doctor and go, hey, I want to ask you about this drug I saw on TV.
Sure.
And maybe they don't even have the condition.
Right.
Right. So I don't see how it does any good for the common good of consumers.
Right.
It does a lot of good for profits.
And you know, I read something very interesting. I'm a little plug. I'm hosting a radio show in the spring semester at the radio station at my university, Alfred University. And the topic is essentially talking about provocative topics of today, like politics, religion, medicine is one of them. And looking up some information, there was a piece of information. It said that there are 2 countries in the world that allow pharmaceutical companies to have commercials on TV: United States and New Zealand. All the rest of the countries in the world is illegal. So I think that's interesting, and I would agree with you that I think it does do more harm than good, because like you said, some schmo can come into their doctor's office and say, "Doc, I saw this commercial for this medication. I want to try it." And sort of, the doctor is sort of handcuffed in a way. So I liked your take on that.
Yeah, because if the doctor doesn't give the patient the medication they ask for, then the patient doesn't like their doctor.
Sure.
Because I'm not getting what I want.
And that's exactly what the pharmaceutical companies want, unfortunately. So low carbohydrate diets, like the ketogenic diet, and I believe Atkins is also a low carbohydrate diet. Can you tell us ultimately what is wrong with those diets? Why aren't those lifestyles or diets really geared towards long-term health?
Well, because they make people sick, and people die prematurely because of them. So they're just not good long-term fixes. I mean, the people do those diets because they lose weight.
Right.
And if you do those diets and you have weight to lose, you're going to lose weight.
Why?
Some of it's probably water weight, and some of it is just a lot of those diets are based off of cutting back your portion sizes or your calories. So when you take in less calories, no matter what you're eating, even if all you're going to eat is Twinkies. I think there was the Twinkie diet.
Right.
If all you're eating is that, but you're eating 500 or 700 calories less, obviously you're going to lose weight because you're under nourishing what your body needs. But like long term, they're just horrible because they usually people can't do it long term. So then they go, well, screw it, I'm just going to go back to how I was eating before, and then they gain all the way back. Another thing is all that, if it's low carbohydrate, that means it's high protein and high fat.
Right.
So we eat way too much protein and we eat way too much fat. And both of those cause problems, especially animal-based protein. So now you're increasing your risk of heart disease, cancer, autoimmune diseases, diabetes, all these chronic diseases that are preventable by doing that. But you lost 20 pounds.
Right.
Right.
And people look at that objectively and say, well, I lost 20 pounds, I must be healthier. But it's hard for people to see things, to see health inside their body and see how their brain is functioning without carbohydrates, and to see the animal fat that may be clogging their arteries. It's hard for people to see that. They can see a weight on the scale,
And it's hard for people to feel that too, because you can't necessarily feel your blood pressure being a little bit elevated,
right?
Or you can't feel a 30-point increase in your cholesterol levels. It's not until you end up in the ER and I'm taking care of you when you have a massive heart attack that becomes a problem. So that is a good point.
One of my previous questions was, for every study, you read studies that say bacon is good, and you read studies that say bacon is bad. I see a lot of controversy on this next question, and that is dietary cholesterol, which, for the record, is only found in animal-based products like dairy and meat. Does dietary cholesterol contribute to blood serum cholesterol, or in other words, the blood cholesterol the cholesterol that is in your blood if you were to draw it out? Does it contribute?
Yeah, it does contribute, not as much as maybe some people think. It's only a small amount. I believe for every 100 milligrams of dietary intake of cholesterol that you take in, you raise your total cholesterol by about 5 points.
Okay.
So it's not a lot, but it's certainly isn't helpful.
Sure.
5 points isn't a lot, but and again, that's only 100 milligrams of dietary cholesterol that you intake. It increases by about 5 points. Now, in an egg, one egg has, I think, about between 200 and 250 milligrams of cholesterol.
Yeah.
So right there, you raise your blood cholesterol levels by about 10 points.
Yeah.
10, 12 points.
Yeah.
And that certainly doesn't help most Americans. Most Americans have a high cholesterol anyway.
Sure.
So it's not helpful. And like you said, only animal foods have measurable amounts of cholesterol in them that you would intake in your diet. Plants do not.
And through evolution, we as humans have developed the ability to produce our own cholesterol because it is so important. So with that in mind, is there a need to consume cholesterol from our food, or are we good just the way we are?
No, we're good just the way we are. Our liver does a great job at producing all the cholesterol that we need, so there's no need to put more inside our body.
Yeah. Another controversial topic of today is oils, is healthy oils, heart healthy oils, the extra virgin olive oils. Can you explain, if we hear a lot on the news about we should be eating more olive oil, more extra virgin olive oil. One thing that is definitely advocated against in this whole foods plant-based lifestyle is no overt oils. Can you explain why we shouldn't be eating oils?
Well, there are no healthy oils. Oils are all 100% fat, and there's very little nutrition in oils at all. There might be some trace amounts of some vitamins and minerals in there, but for the most part, you're getting pure fat. And that fat lines your arteries and causes clogged arteries and strokes and heart attacks. And just to point out, there's been several studies been done that intervention studies have been testing people, and they'll put the two different groups on the same meal, but one will have olive oil or some other kind of oil, and the other will not have that oil, and that's the only difference. And then they'll measure their blood flow an hour, 2 hours, 3, 4 hours after the meal. And it's been shown that there's about 25 to 30% reduction in blood flow when you consume oil with that meal for up to like 4 hours after the meal. And when you look at some of the population-based studies, the reason why they say olive oil is heart healthy is because the Mediterranean diet has lots of olive oil in it. They have less heart disease. And I always tell people less heart disease is not the same thing as no heart disease.
Right.
There's a completely different scale there. So when you go from eating a really unhealthy diet like the standard American diet to eating the Mediterranean diet, where there's more fruits and vegetables and more whole grains, and then they have olive oil in there, you've just replaced a lot of that fat, that saturated and trans fat in the standard American diet, with less saturated fat from maybe using olive oil and eating more fruits and veggies. And of course, you're going to have less heart disease. So I've actually seen population-based studies where they looked at the standard American diet, they looked at the Mediterranean diet, and then they looked at the Japanese diet, traditional Japanese diet, which is basically no oil and a lot of rice and vegetables and just very little animal products. And the rates of heart disease was, of course, highest in the Americans, standard American diet. And then the Mediterranean diet still had about a 2.5 times increased risk of increased rates of ischemic heart disease as the Japanese diet. And we know that the Mediterranean diet is full of lots of olive oil. So olive oil and other oils are not healthy, and they don't help. They don't improve your health at all. If anything, it's how much can you get away with.
Right. So what it sounds like is it's a sliding scale. In other words, you have on the one end you have the standard American diet, okay, and you give up a little bit of saturated fat and some of the oils, and you get to the Mediterranean diet. Okay, you see healthier than this diet, but as you slide down and as you get rid of more of the oils, it's healthy. It's healthier until when you eliminate all oils, it's the healthiest you could possibly be.
Right,
Right.
right. And I think the proof is in Dr. Esselstyn and Dr. Ornish's studies
Mm-hmm.
on reversing heart disease, because they did a plant-based diet with no oils.
Right.
Nobody's ever published better results than them in an interventional study for reversing heart disease.
Right. Right. Absolutely. Completely agree. On page 7 of your book, you make a reference to making smarter choices in reference to prostate, lung, and colorectal cancer. Can you explain what that means and how, and can we actually treat and prevent cancers through diet?
Well, it's very simple. Making better choices just is a matter of changing your habits and your diet and your lifestyle. It comes down to eating better, exercising, don't smoke, don't drink, and take care of yourself. Get plenty of sleep. Try to do stress reduction exercises like yoga or meditation. And just by doing those things, I always tell people, step number 1 with a lot of these chronic diseases, including cancer, is get rid of the bad stuff that's causing it first.
Mm-hmm.
So if you stop smoking, you're going to have less chance of having lung cancer. If you stop eating animal food, then you're going to have a lot less chance of having colorectal cancer.
Mm-hmm.
Those are the primary causes of these diseases. So then step number 2 is adding in the good stuff.
Mm-hmm.
Then that's when you want to add the fruits and the veggies and whole grains and the beans and all that good stuff, because it has antioxidants and it's, those are cancer fighting foods.
Mm-hmm.
But first you got to get rid of the bad stuff.
Mm-hmm.
And when you do that, some people have been able to treat their cancers and do it with nutrition. Some cancers are more receptive than others. A lot of the hormone cancers are, like prostate and breast cancer. Colorectal cancer is another one. But cancer is a very tricky disease, and you can't just say that all cancers are going to respond the same way to making a diet and lifestyle change.
Mm-hmm. Mm-hmm.
We still have a lot of work to do with cancer research, and specifically with nutrition and cancer.
But it's certainly worth a shot.
Oh, it doesn't hurt nothing.
Yeah.
If anything, it helps.
Right.
Switching to a whole foods plant-based diet and getting rid of the animal foods, getting rid of the oils and the fats and the processed foods. Mm-hmm. Certainly, that only helps people. It doesn't hurt them.
We've spoken a lot up to this point about fats, animal proteins, and how and dietary cholesterol, which sort of clogs the arteries, leads to chronic diseases such as atherosclerosis. You have a heart attack, you have a stroke. Can you, what role do inflammatory foods play in the chronic disease equation? And perhaps explain what inflammatory foods are.
Well, inflammatory foods are, a lot of the processed foods are inflammatory. The ones that are loaded with added fats and added sugars. So a lot of the meats, the dairies, those are inflammatory foods. And when you eat that stuff every day, 3 times a day, for years and decades on end, you have chronic inflammation, and some people get metabolic syndrome, which is, chronic inflammation, and then high poor blood levels of, their blood markers with cholesterol and high blood pressure and all kinds of things like that. Mm-hmm. But a lot of these chronic diseases have chronic inflammation at their base. Mm-hmm. Whether it's with hypertension and you have inflamed arteries, or whether it's with other disease states, autoimmune diseases, where you have like arthritis and you have inflammation of the joints, or a lot of these diseases have chronic inflammation at their base. So when you get rid of the bad foods that are pro-inflammatory, that have a lot of omega-6s, omega-6 fatty acids are plentiful in processed and animal-based foods, and those are pro-inflammatory omega fats. Mm-hmm. Omega-3s are plentiful in plant foods, and those are anti-inflammatory. Mm-hmm. So when you switch from a diet that is very, very heavy in omega-6s that are pro-inflammatory and has very little omega-3s to a diet that has about the same ratio, about a 1-to-1 ratio or about a 2-to-1 ratio, then you're doing your body a huge favor and you're reducing that chronic inflammation.
Mm-hmm. Very good. Terrific. Without giving away too much of what's in your book, one thing that reading your book for the first time, I had heard, I'm sorry, let me put this another way. I had heard for the first time after reading your book that you can actually prevent, treat, or reduce the chances of getting certain autoimmune disorders through diet. Can you explain a couple of the major ones that you read about and how they're influenced by diet?
Yeah, when I first found out about this, I was just like flabbergasted. I just was like, I can't believe that these autoimmune diseases have anything to do with diet. Because in school, we're taught that the only thing that you can really do to help those people is put them on steroids and other really nasty medications that are, biologic agents or basically medications that suppress your immune system. So when I found out that the diseases themselves, a lot of these autoimmune diseases are due to basically the animal protein that in people who are genetically susceptible to, say, rheumatoid arthritis or Crohn's disease or lupus or psoriasis or these autoimmune disorders like this, their body recognizes animal protein as a foreign substance, and so it makes antibodies towards it, and then it wants to attack that. And sometimes, say you got a patient who has RA, rheumatoid arthritis. Well, they recognize the animal protein as foreign, so they make antibodies against it. The tissues and cells in their joints are very similar to maybe the look of that animal protein. So now their body attacks the joints. For somebody with lupus, they can attack any cell or tissue in the body. Somebody with Crohn's disease or ulcerative colitis, it's going to attack the gut, the intestines. So when you get rid of the animal protein, that does wonders for many of the people with these autoimmune diseases. Now, some of them will also have to go another step further, and they might have a gluten sensitivity or gluten disorder like celiac disease or one of the other ones. So after they remove all the animal protein, if they're still having problems, some people still benefit from removing gluten too. I don't usually recommend that. Right away, I usually recommend get rid of the animal protein first and the processed foods. So processed foods, like again, we talked about, are very inflammatory. So even though you've gotten rid of the main cause, which is the animal protein, if you're still eating processed foods, processed vegetarian and vegan foods, you're still causing inflammation to the body. And that's what a lot of these autoimmune diseases are. They're inflammatory processes with certain parts of the body.
Sure. So it sounds, like the chronic diseases, we're not saying if you switch your diet to a whole foods plant-based diet, it's not a guarantee that you're going to 100% treat all these chronic diseases. In the same way, you're not going to treat every single autoimmune disorder, but it can't help. Or I'm sorry, it can't hurt. It can't hurt to change your diet.
Exactly.
Right.
It can't hurt. Right. And it depends on what you have. I've helped patients with autoimmune diseases. One lady, I was able to help her put her lupus into remission, like permanently.
Yeah.
She's also a case where, her dad died of lupus. Now, if she has one meal that she cheats on, she starts getting the pains back in her joints and stuff. And so some people are so sensitive that they just have one meal with an autoimmune disease and they start having problems again.
That's powerful. That's very powerful. So I want to, if it's okay with you, I want to skip a couple of the additional questions I had and go right to the questions that were submitted by people who follow the Plant-Based Cyclist Facebook page and also people within the Let Food Be Thy Medicine group, if that's okay with you.
Yeah, it's a great group, by the way.
It is a great group, very supportive, great administrators. They keep the junk out, they keep the crap articles out, and all the spammers, which is huge on Facebook, and they do a really terrific job. And I want to start this off by saying, if for any reason you want to skip one of these and say, I'm not really comfortable with that, I don't know a whole lot, no problem. And the second thing is that for anybody who is watching this who may have one of these disorders, diseases, or who you're like, oh, that's a great question, I can benefit from that. What we're both saying, especially you, the advice you're giving is not should not be followed without letting your doctor know. Correct?
Yeah, absolutely.
Okay.
Because there sometimes you get some of these questions and they're kind of loaded questions, and
Right.
you don't know like 9/10 of the story. So you always have to check with your healthcare provider, your physician.
Right. Consult with your doctor, ladies and gentlemen. We have a question about CoQ10. Can you talk about, do you know what is it for? Is it beneficial? And what brands you may recommend, or plant-based alternatives?
Well, CoQ10 is really a substance that is involved in the electron transport chain. So that's the process that happens in the body, usually to make energy.
Mm-hmm.
So it also acts as an antioxidant. So those are basically the two main functions: is to help make energy and to act as an antioxidant. So some people will take it. I think it's marketed to take with just about every disease out there.
Mm-hmm.
But a lot of people will take it if they have heart disease, or sometimes if they have cancer, to help them with those diseases. And I'm not saying that it doesn't work. Maybe it does. I haven't read an extensive amount of studies with it.
Mm-hmm.
But here's my take on anything,
Mm-hmm.
whether it comes a prescription, over-the-counter supplement, or a new diet, or whatever you want to try, a device or a procedure or whatever, is that the safest, most effective, and least costly method to fix your problem?
Mm-hmm.
You know what I mean? So if you're taking it for heart disease, and you have high cholesterol and hypertension and all this, and you want to help yourself prevent a heart attack or a stroke, well, you could do all that same stuff, and you can do it with just a change in diet.
Mm-hmm.
You can change your diet to a whole foods plant-based diet,
Mm-hmm.
and you can eliminate your risk for heart attacks and strokes.
Mm-hmm.
Or if you're taking the CoQ10, I think it's like $10 for a month's supply, or $15 for a month's supply.
Mm-hmm.
If you're going to take that, it's basically just like a prescription where you're going to have to take it for the rest of your life. If you really want to get the benefit of it.
Right.
So if you're taking that, I actually worked that out, the numbers out on that. So if you take it for 20 years, that's $2,500.
Mm-hmm.
Take it for 30 years, that's $3,000, $3,500. So is that worth it to you? Spending that? I mean,
Mm-hmm.
I'd rather spend the $2,500 on food.
Sure, produce.
I mean,
Yeah.
and there's always side effects. So there's always, even if it's a supplement, there's almost always side effects. And with CoQ10, there are some side effects.
Mm-hmm.
I believe some GI disturbances like heartburn and maybe nausea,
Mm-hmm.
vomiting, those kind of things can pop up. So
Right.
it's just, you have to. I'm not saying don't take it. I'm not saying do take it. I'm just saying, like with any pill that you take, or any medical procedure, anything that you do medically, you need to look at the pros and the cons,
Mm-hmm.
and the cost of it, and the safety of it, and is that worth it to you?
Right. Right. And unlike any pill or supplement or CoQ10, unless you are specifically allergic to a vegetable or fruit, there's no side effects of eating broccoli. The side effects are good side effects.
Exactly.
We had a question about thyroid nodules. Now, some of these are a little vague, and like you said, it varies from patient to patient. Have you read any studies having to do with natural remedies for thyroid nodules?
I don't know of any natural remedies for thyroid nodules. I know that I think another question I saw that you'd sent to me was about hypothyroidism too.
Mm-hmm.
So when it comes to the thyroid health, there are autoimmune diseases that commonly cause thyroid problems, and one is Hashimoto's disease, which is the hypothyroidism. Another one is, I believe, Graves' disease, which is the hyperthyroidism. They're both autoimmune diseases. So those are the majority of thyroid problems in people. Now, of course, if you're hyperthyroid, that means you're producing too much thyroid.
Yeah.
Sometimes that's caused by a tumor that's on the thyroid, and maybe it's cancer, but maybe it's not cancer. It can be a non-cancerous one that's just making your thyroid go into overdrive and out lots of thyroid hormone. So a lot of times in that, there are medications that you can use, but they also go in and they do ablation, or they do surgery to actually disable part of the thyroid or cut out part of the thyroid that's causing the problem.
Right.
Now, hypothyroid, that's a different story, especially in Hashimoto's, because now you have an autoimmune disease that's permanently destroyed your thyroid cells.
Yeah.
And if once they're destroyed, it doesn't just grow back. So the only thing that I know of is to take medication, the levothyroxine and the other various manufacturers that make that, to basically replace that thyroid hormone in your body.
Great.
Now, there is one person that has done quite a bit of research on hypothyroidism. It's Elena Wilkins. She's in the plant-based community. She has a website, vegalicious.com.
Okay.
So if you just look up Elena Wilkins, she actually has, she said that she's cured herself of hypothyroidism by just changing her diet. And she said that she's had clients too that she's taken on that have also been able to do that. Now, I don't know the whole backstory with her medical and her chart and everything. So I'm not saying that I've never seen an interventional study that's been able to put people on a whole foods plant-based diet and reverse hypothyroidism. But obviously some people have benefited tremendously by doing that. I have seen studies that have shown you can prevent hypothyroidism by going vegetarian or vegan. There's less of a risk and there's less of a rate of hypothyroidism in those groups. So
good, terrific. So that covered the Hashimoto's question number 16 that I sent to you, and also thyroid drug replacements. Is there any? Can you any changes through diet to perhaps get off of thyroid drug replacements? And I think you kind of covered that as well. Is there anything else that you want to say on that?
The only thing with thyroid medications, if you're on the levothyroxine or Synthroid or whatever brand that you're on, that's considered a narrow therapeutic index drug, which means it has a very small window in your blood that it has to stay at to work properly. So you have to go back and get blood tests and make sure that you're in that window. And if you're not, you adjust the dose by just a little bit up or a little bit down, and you got to work with your doctor with that. So don't go messing with your medication and your doses with that. And when you're on a medication, I would stay on that same manufacturer. Like if you're on the generic, stay on the generic. If you're on the brand, stay on the brand. Because when you switch manufacturers like that, it can tweak it just enough that you go outside that window, and now you have to go and adjust your dose. So just be very careful if you're on thyroid medication.
Good advice on that. We had several members put the thumbs up on this next question. They wanted to know your take on vaccines. Have you read any studies that suggest that there's a lot of hype in the media right now that vaccines may be harmful in some way? Can you touch on that at all?
Well, I'm certainly no expert in vaccines, but I have read a little bit on a few of them. Now, they do use some preservatives like thimerosal, mercury-containing preservatives like thimerosal in some of these vaccines, and other chemicals in them. So, are some of those harmful? Possibly. I haven't read enough to see overall, what the take is. And I don't think that you can just make a blanket statement and go, all vaccines are bad.
Right.
Or go, everybody needs every vaccine.
Sure.
It's way too complex to do that. And it wouldn't be responsible to do that. Now, I have looked at the flu vaccine for one, and I've gone to the Cochrane collaboration is a great one to go to. Look at the Cochrane reviews on some of these vaccines, and they do probably some of the best jobs at telling you unbiasedly whether a particular vaccine is good or whether it's maybe not as effective as we thought. Now, with the flu vaccine, what they do is they take the flu strains from the last couple of years,
Right.
and then they put it in like this year's model, and then they, give that to people and hope that that protects people. Well, the flu is caused by over 200 different viruses.
Right.
And it's constantly changing. So you'll see a lot of reports, even in the media, that says, this year's flu vaccine wasn't as effective as we'd hoped it to be. And that's pretty common. From what I read in the real world situation, 100 people have to take the flu vaccine for one person to avoid the flu. So should you take the flu vaccine? I don't know. Is that worth it to you? I can't make that decision for you.
Sure.
You have to make that decision.
Sure.
But when like the pneumococcal vaccine that prevents pneumonia. Now, pneumonia is not caused by over 200 plus organisms. It's a lot less, maybe 20 or 30.
Sure.
So your chances of being helped by the pneumonia vaccine are a lot higher, especially if you're elderly or have some respiratory issues, than using the flu vaccine. It doesn't mean you should get them both or you should not get them both. That's up to you.
Right.
You have to take that into account.
Right.
But some of the vaccines have been very important in history. Smallpox vaccine, polio vaccine.
Right.
I had a gentleman that is from my hometown. He had polio, and I can remember as a kid, one of his sons was a year ahead of me in high school, in grade school and high school. And I just remember seeing his father all the time come to the ball games and school functions and stuff for his son. And he was crippled.
Right.
He was crippled from polio.
Right.
And, I look at that and I see how much of an impact that had on him and his children. And, I'm thankful that I got the polio vaccine when I was a kid, because I never want to have to go through what I saw him go through. So it's kind of it's a complex subject.
Sure. And just as a little plug, I'm going to be making a movie hopefully in the next couple weeks on this very topic, on vaccines, because I think there is a lot of misinformation out there. So stay, all the fans of this who are watching this movie, I'm going to make a movie on that. Well, good. Thanks. That's a great answer. Can you talk about B12 supplementation for those on a plant-based diet? Is it beneficial? How much should we take? And can you recommend any brands or any sources?
I definitely think that people should supplement with B12. B12 is one of only 2 vitamins that you can't get in plant foods naturally. Well, especially with the quality of our soil and how we grow things nowadays. B12 is actually made by bacteria, and there is you can get B12 supplements for real cheap, probably $5-10 for a big huge bottle of it. And it's important because B12 does 3 things. It helps with DNA synthesis, it helps with the formation of red blood cells, and it helps with the functioning of your nerve cells and your brain cells. So if you don't have it, you can become anemic, you can start to have central nervous system problems, memory, cognition problems, forgetfulness, those kind of problems. And it's very important. It takes years for that kind of stuff to show up after having a B12 deficiency. So you're talking anywhere from, I think, an average of 7 or 10 years before symptoms will start to show up. So it's just something that's real quick and easy to do. Take a B12 supplement. It's water soluble, so you can't overdose on it.
Sure.
And I always recommend to take anywhere from 500 to 1,000 micrograms a day. Your body doesn't actually absorb all of that. You only absorb about 1 or 2% of that. And the daily intake for humans that you need on a daily basis is only about 10 micrograms.
Right.
So 10 micrograms is 1% of 1,000.
Yeah.
If you only absorb 1 or 2%, if you take 500 or 1,000 micrograms, you're getting all that you need. And vitamin B12 it's dependent on intrinsic factor in the gut.
Mm-hmm.
That's what it kind of latches onto to get absorbed into the bloodstream. So if you're a person and you have a deficiency in intrinsic factor, then you might have to look at maybe getting B12 shots or doing sublingual B12
Mm-hmm.
or doing the patch of B12. So it's just something that you want to check with your doctor on. But you can see what your B12 level is. You can have your doctor do a very easy blood test,
Mm-hmm.
see where you're at. You can do a B12 level, see where you're at. You can also do a methylmalonic acid level. That kind of is a marker of B12 status. Some say it's a little bit more accurate as far as true B12 status of an individual. Those are both blood tests, and you can have your doctor do them and take care of some serious medical problems and anemia and mental cognition problems that nobody would go through.
Gotcha. Sorry.
As far as brands, I don't have any specific brands that I usually recommend.
Gotcha. And I apologize if you may hear my dogs in the background barking at people on the sidewalk. Can you
Very friendly. Right?
can you talk about aspirin? Someone wanted to know about aspirin. She takes a 1-a-day aspirin. Any potential side effects on the body long term, or she said specifically, could it interact with a drug like lisinopril?
Okay, so with aspirin, the biggest and most the biggest side effect that we would worry about is bleeding.
Okay.
Because aspirin is basically an antiplatelet drug, so it reduces your platelets. You need platelets to clot and help you so you stop bleeding.
Right.
So you can bleed easier. If you cut yourself, you're not going to clot as easy. You bruise easier with aspirin, and especially if you're taking it with other medications that also thin the blood.
Right.
Some people might have atrial fibrillation. It's a heart arrhythmia,
Mm-hmm.
and they go on aspirin. Maybe they're on warfarin, which is another blood thinner.
Mm-hmm.
So they're on a combination of products. Some people might have had a stroke or a cardiovascular event, and maybe they put on Plavix, which is an even more powerful antiplatelet, and then they're also on the aspirin. So when you combine drugs like that, you really got to be careful, because then it can really thin your blood and you can bruise and bleed easier.
Mm-hmm.
As far as aspirin and lisinopril, there is a slight interaction there.
Mm-hmm.
It's not a major one, like if you have two blood thinners together, but it can cause a lower efficacy rate of lisinopril, of the antihypertensive effect.
Okay.
So in that case, I haven't personally seen it, but I know that it's out there, that drug interaction is possible.
Okay.
It's one of those that you might have to have your doctor increase the lisinopril dose to get the blood pressure to where it needs to be. But then again, blood pressure is usually a nutritional disease, and if you take care of the nutrition part, a lot of times patients can get off or at least reduce a lot of their medications for that.
Very good. Very good. Any natural plant-based cough remedies when you're sick that you've heard of, that you've read about?
Boy, not that I know of.
Yeah, and that's fine. Some of these questions are a little bit more kind of herbal and less medical than others, but okay. And if you think of one, you can always chime in a little bit later.
A lot of prescription cough medications I could tell you about,
There you
but
go.
I don't know of any natural ones.
Gotcha. Iron ferritin tablets, yay or nay?
That's kind of a loaded question. I don't really know. That's really a loaded question. It's like, why are you taking iron?
Right.
Do you have iron deficiency anemia?
Mm-hmm.
Do you have anemia at all?
Mm-hmm.
Sometimes anemia can be caused by B12 deficiency. There's all kinds of different reasons why you might have an anemia,
Right.
and it might not be iron,
Mm-hmm.
but it might be iron,
Mm-hmm.
and so maybe you do need it.
Mm-hmm.
Iron ferritin is basically helps restore the stores of iron that are built up in your body that in your bloodstream. So it may be beneficial, it may not. It's all depends on the medical condition.
Right, and on the person, on the individual person. So in other words, I think what you're saying is consult with your doctor. There's also
Right.
a lot of plant-based sources of iron out there. So just do a Google search on plant-based sources of iron and see if that helps as well.
Yeah, beans and greens are great for iron.
Beans and greens.
Yep.
COPD and a steroid long-active inhaler.
Mhm.
Is there another way? Is there an alternative to that you've heard of?
Well, actually, there are studies out there that show that eating more fruits and vegetables and whole plant-based foods like that help to reduce the, I don't know what you want to call it, maybe the symptoms or the severity of COPD.
Mm-hmm.
And I think one study in particular that I saw, they took two groups of people and they just asked the one group of people to just eat one more serving of fruits or vegetables a day, and the other group they didn't say that.
Mm-hmm.
So the group that did not eat one more serving of fruits and vegetables a day, of course, their lung function, steadily declined over the months and years.
Mm-hmm.
The group that did eat more fruits and vegetables, it kind of stayed even, their lung function,
Mm-hmm.
and it didn't necessarily get terribly worse, but it didn't get phenomenally better.
Okay.
Which is still a good thing.
Sure.
Because there's no side effects to eating fruits and vegetables. And COPD is a chronic disease that the progression of the disease is basically you're losing the permanent function of the alveoli and the other the other cells and tissues in the lungs they don't work because
Sure.
you have emphysema or you've been exposed to smoke or pollutants or whatever it is to cause that. And so over time, the way that COPD works is, you start out with really good lung function way up here, and then you get COPD, and eventually you get worse and worse and worse and worse and worse, and then you die.
Mm-hmm.
And that's just and that's with the best medications.
Mm-hmm.
So usually we start people out with COPD on a short-term bronchodilator to try to open up their bronchi and their airways.
Yeah.
But sometimes that won't work, and so we'll have to. The next thing you go is you go to a long-term anticholinergic inhaler like Spiriva,
Mm-hmm.
or Two Doors, I think is another one. Or you go to a long-acting bronchodilator like Formoterol or Salmeterol, and then you can, once those, they'll work for a little bit. They'll help control symptoms. But eventually, like I said, you just kind of keep going down
Right.
with your function. So once you start getting worse, that's when you add maybe a long-term steroid inhaler to these long-acting bronchodilators or the long-acting anticholinergic inhaler. And sometimes you end up with people on all three.
Mm.
And at the end stage of their disease. But COPD it's not something that you can really reverse that I know of.
Okay.
You could just hope that you can keep it at bay as long as possible.
Good. Very good. Someone had a recent stroke. Their friend recommended taking zinc sulfate to repair nerves that may have been damaged due to the stroke. Are there any plant-based remedies, first of all, to strokes, and second of all, to add more zinc sulfate to your diet, if that's even necessary?
The zinc sulfate, I'm not sure on.
Okay.
I haven't read anything on that. Now, as far as strokes, yeah, just eating a whole foods plant-based diet, eliminating or reducing the animal foods, the high-fat foods, the oils, those kind of foods will help prevent strokes. Now, once you have a stroke, depends on how bad it is.
Mm-hmm.
Some people are completely disabled,
Mm-hmm.
and they can't even care for themselves anymore.
Right.
Some people, I have a friend who had a stroke, and she has partial blindness on her peripheral side on one of her eyes. So, sometimes it can do a lot of damage. Sometimes it can do a little damage. Sometimes that damage is permanent. Sometimes it's not. Sometimes you can work through it with physical therapy, occupational therapy, that kind of stuff.
Mm-hmm.
But the best thing that we know of is to eat a healthy plant-based diet to prevent it from happening in the first place.
There you go. Sounds great. Good advice. This next one, I'll have to get a little bit closer. There was a study, I'm not sure if I sent you the link, it was on the BBC article, I guess, that treated 3 patients with alopecia with a drug for bone marrow disorders called ruxolitinib, and all 3 of these people with alopecia saw total hair regrowth. And the question was, are you familiar at all with this study or any studies that show, is there any validity to this? Have you any knowledge on this?
Well, I looked at the actual article that you sent me,
Yeah.
and it did, obviously those 3 people did benefit from that medication quite a bit.
Sure.
So those would really be considered, case studies or case reports, because they're individual people.
Right.
I don't know if there's any. I don't think that there's any large-scale interventional studies on this. This drug is actually an anti-cancer drug.
Okay.
So it's traditionally used to treat a blood cancer.
Okay.
And as many people out there know, whenever you have a anti-neoplastic drug or an anti-cancer drug, the side effects are horrific.
Yeah.
So this drug actually, for anybody out there who wants a really good reference on any particular drug, just go to Google, put in the drug name,
Yep.
and then put in Medscape,
Okay.
MEDSCAPE. And you can come up with a Medscape. It's you can go on there. They have the drug. You can see how it works, what it's used for, what the adverse effects are, all kinds of stuff with it. And when you look this drug up on Medscape, and I actually looked it up at work too, on Lexicomp and Clinical Pharmacology. Those are some resources that physicians and pharmacists have that the public doesn't have.
Right.
But it all says the same thing as far as adverse effects. It can cause anemia in 96% of the patients.
Okay.
It can cause low platelets in about 70% of the patients. So if you have low platelets, then you can't clot very well. So now you're bleeding and you're bruising easier.
Yep.
So a quarter of the patients will have bruising. Reduces your white blood cells. It can cause liver damage in up to like 16, 17% of the people. And cause headache in about 15%. So a lot of these, this medication there's just so many side effects with this.
Yeah.
And again, I'm not saying to use it or not use it to regrow hair, but you have to look at these side effects.
Right.
And you have to look at what you're getting for hair growth,
Right.
and is that worth it to you?
Right.
Not to mention that I almost guarantee you the insurance company is probably not going to cover this for hair growth because there's no large-scale studies. So I don't know how many of hundreds or thousands of dollars this drug is, but I know that these new specialty drugs like this usually run in the thousands or tens of thousands or even hundreds of thousands of dollars.
Yeah. That's another great point. That's a great point. We only have a few more here to finish off with. I think 2 or 3 more here. Let's final push. Any recommendations? Any over-the-counter recommendations for creams or rashes? For recommendations for over-the-counter creams for rashes. Again, a vague question.
Yeah, I guess it depends on what kind of rash it is.
Sure.
Is it a rash because you got bits by some mosquitoes or something and it's just irritated? Then maybe something like hydrocortisone cream or Benadryl cream might help you out good there. But is it a rash? Maybe in the groin area or down by having athlete's foot and it's a fungal infection. Then something like Lamisil would work better because that's an antifungal cream. So it completely depends on what the rash is from and what you're treating.
Sure.
You certainly you don't want to use Lamisil on just a mosquito bite because that's not due to a fungus. And if you use hydrocortisone on a fungal infection, it's not going to fix it.
Sure.
So you really got to know what you're treating,
Right.
and go from there.
It certainly varies from rash to rash. See your general practitioner or see a dermatologist.
Right.
Any herbal or natural recommendations for lowering cholesterol? I think we kind of already went over this, keeping your dietary cholesterol low. But let's say someone may have a chronic hyper cholesterol. Any natural remedies to lower it?
Well, of course, I always recommend doing a whole foods plant-based diet, because most people will be able to get their cholesterol down, usually below that 150 mark for the total cholesterol, which is where you're kind of heart attack proof,
Sure.
by just changing what they eat and being diligent with that. Now, if you don't necessarily want to adopt that diet, or maybe you do adopt that diet, maybe some people are more genetically predisposed to having high cholesterol. So there's 1 in 400 or 1 in 500 people will have familial hypercholesterolemia.
Right.
And that's where they just have a genetic problem with one of their genes and how they're able to clear cholesterol. And no matter how good they eat, they're going to have high cholesterol.
Sure.
Usually in those cases, you need a small dose of a prescription strength lipid lowering drug to get it down to that 150 mark or below. But as far as natural remedies, the only one that I can think of off the top of my head is red yeast rice.
Okay.
And red yeast rice is actually it has lovastatin. It is lovastatin. It's like a less powerful version of lovastatin. So it's kind of like a statin.
Interesting.
It reduces your total cholesterol levels by about, I think it was about 15%, about 13 to 15%, and your bad cholesterol by about 20%. So that's actually a pretty good drop right there.
Yeah.
Now, like I said, with any supplement or medication, there's always going to be possible side effects. And with red yeast rice, it's not uncommon as well to have side effects with that. So some people will get GI symptoms. They'll have abdominal discomfort or heartburn or some problems there. And then also it is a statin, and the statins can increase your liver enzymes, so it can cause some liver damage. So you just want to be careful. If you're going to take that, you need to tell your doctor and make sure that he's monitoring you for that. Now, it's probably less likely that's going to elevate your liver enzymes than the statins, because they're a little bit more prescription strength, but that's still there. That chance is still there.
Good. That was good advice. Last one here. Let's do it. Someone said they have a reaction to direct sunlight, a disorder called polymorphic light eruption X. Doctors are giving her steroid creams to treat it, and she's looking for any natural remedies that you're aware of.
I actually am not familiar at all with that, so I don't think I'm going to be very much help at all. I'm sorry, but I'm not familiar with that.
Okay, no, fair enough. And I want to always, with all my interviews, give the last word to my guests, and also along with that, feel free to mention how people can find you and maybe be able to connect with you.
Yeah, well, I really appreciate you having me, Ian, and it's been a pleasure. I think that I really admire the work that you're doing too, and being out there and being the plant-based cyclist and showing that you can eat well, eat healthy, stay active, and still compete at a pretty high level. So it's very admirable to see that in you. And we all just need to do our best to spread the word of eating healthy through a plant-based nutrition plan and staying active. And that's how we're going to fix this healthcare crisis. And you benefit, as the person listening out there right here, you benefit the most in taking control of your health. It's not your physician and your pharmacist and your nurse and all your healthcare providers are not waking up and getting out of bed every day and going, man, I wonder how Joe's doing, with his whatever disease he has, or I wonder how Mary's doing with whatever disease she has. We see you in the office or in the hospital. We do our best to kind of get you back up and running. But ultimately, it's your life.
Mm-hmm.
You're only given one life to live and one body to live it in. So take care of it.
Yeah.
It's important to take care of it.
Absolutely.
And as far as where people can find me, you can just go on my website, plantbasedpharmacist.com. And there's all kinds of information on there. My articles, my blog, my book is on there if you want to check that out. The Empty Medicine Cabinet. And yeah, you can find me on there. I'm on social media, Facebook, Twitter, Google Plus, all of those. So you can check me out on there too.
Great. And thank you for the interview you just did with me. It just got published today, and it looks great.
Yes.
And
Yeah.
say again.
A phenomenal interview. When I posted it and told people that this guy bicycled across the entire United States on a plant-based diet, that piqued their interest right there.
Yeah. And I will, in the introduction, put a plug in for your book, and I'll show what the actual cover looks like. So, again, for the second interview we've done, thank you so much for your time, Dustin Rudolph.
Thanks so much, Ian. Appreciate it.
Bye-bye.
Bye-bye.